How you reduce intraoperative bleeding. Pre-operative, you can give some strategies like erythropoietin. This is erythrocyte stimulating glycoprotein made by kidneys. You can give tranexamic acid 1 gram prior to the incision. You need to have iron, vitamin B12, and folate supplement if there is a low iron or vitamin B12 or folate. Intraoperative, you can use diathermy, tourniquet, controlled hypotensive anesthesia, local adrenaline injection, cell savage technique, and topical hemostatic agent like fibrin sealant. Post-operative, you can do reinfusion drains. Regarding tranexamic acid, its usage is you give 3 grams, introduce into the joint cavity before deflating the tourniquet. Leave in the bath in periarticular tissue for 5 minutes. Then remove with the suction drain. Regarding cell saver technique, it collects blood, wash it with saline, make it concentrated to 225 ml, make a hematocrit of 55%, and then it is transfused or washed again and saved. Disadvantage is that it reduces the percentage PRBC. So basically the concept is the patient blood is extracted, it is heparinized, is washed with heparinized saline, and then it goes to the cell saver, then it's washed again with saline and transfused to the patient. Autotransfusion is also another technique. The benefit is that it has high level of 2,3 DPG, no problem of normothermia, pH is optimal, reduce infection risk, reduce allogenicity, quickly available. Disadvantage is reduced plasma and reduced platelets.